Will tonsillectomy help sleep apnea? If you're struggling with sleep apnea and wondering if removing your tonsils could be the solution, you're not alone. Let's explore this option in detail to see if it might be right for you. First, it's important to understand what sleep apnea is and how tonsils can play a role. Sleep apnea is a condition where you stop breathing for short periods during sleep, often due to an obstruction in the airway. For some people, especially children, enlarged tonsils can be a major cause of this obstruction. In children, removing the tonsils and adenoids is a common and often effective treatment for sleep apnea. However, for adults, the situation is a bit different. Adults typically have smaller tonsils than children, and their sleep apnea is often caused by a combination of factors, including obesity, other anatomical issues, or even lifestyle factors. But what if you're an adult with significantly enlarged tonsils? Here's where things get interesting. Studies have shown that for adults with markedly enlarged tonsils, usually size 3 plus or 4 plus on the Friedman scale, and no substantial obesity, a tonsillectomy can be very effective. One study found that after undergoing tonsillectomy, the average apnea-hypopnea index, AHI, decreased dramatically from 40 to 7 events per hour, and most patients saw a significant reduction in daytime sleepiness. To be considered for this surgery, your doctor will typically look for a few key factors. Your tonsils need to be significantly enlarged, and you should not be substantially overweight. Additionally, you should have tried other treatments for sleep apnea, such as CPAP therapy, without success, or have been advised by an otolaryngologist that your tonsils are the primary cause of your sleep apnea. It's also important to note that while tonsillectomy can be very effective for some adults, it's not a magic solution for everyone. Many adults will still need to use CPAP therapy after the surgery to fully manage their sleep apnea. However, for those who are good candidates, the surgery can significantly reduce or even eliminate the need for CPAP. In terms of the procedure itself, a tonsillectomy is a one-time surgical operation where the tonsils are removed from the back of the throat. Before the surgery, your doctor will check your overall health to ensure you're fit for the operation and provide guidelines to prepare you. While there are risks such as bleeding or infection, the benefits can be substantial, including easier breathing, reduced snoring, and improved sleep quality. So to answer your question, yes, a tonsillectomy can help with sleep apnea, especially if you have markedly enlarged tonsils that are causing the obstruction. However, it's crucial to consult with your doctor to determine if this is the right option for you. They will help you evaluate whether your tonsils are the primary cause of your sleep apnea and if surgery would be beneficial in your case.